Welcome back. Hot flushes, mood swings, and sleepless nights. 7 in 10 women in Singapore face these menopause symptoms, yet most suffer in silence, and such symptoms often go untreated due to a lack of awareness. Now, Singapore's first menopause management guidelines aim to help such women get the care they need by giving doctors clearer guidance on how to manage them and standardising treatments across healthcare settings. Sabrina Ng reports.
For 86-year-old Ms. Lee, her symptoms began with sudden hot flashes. Though it happened about 40 years ago, she still remembers the experience vividly. After about a month of worsening mood swings, she decided to see a doctor.
Menopause never crossed my mind, but I did have some of my colleagues tell me, you better go and see a doctor lah. So grumpy every now and then.
Ms. Lee is not alone. A study by KK Women's and Children's Hospital involving nearly 1,500 women aged 45 to 65 found that almost all experience at least one of 29 common menopausal symptoms. Research found that the commonly experienced symptoms here of women going through menopause include joint and muscle ache, fatigue, and poor sleep. Now, this is different from what is commonly experienced by women in the Western population, which includes hot flushes and night sweats. Despite the symptoms, many women do not seek help, often because they don't recognize what they're experiencing. Many healthcare professionals, too, report a lack of confidence in diagnosing or treating menopausal symptoms.
This matters even more when we consider our demographic future. Singapore is projected to become a super-aged society by 2030. This means women need to remain healthy, active, and engaged for longer. When we improve menopause care, we're not just addressing immediate symptoms, but we're also safeguarding women's long-term health and well-being.
That's why KKH launched Singapore's first set of guidelines on managing menopause transition. They set out clear criteria for diagnosing menopause, including relying on patient history for women over 45 with typical symptoms. While the guidelines are targeted at clinicians, the goal is to ensure women receive more consistent and timely care.
The average woman in Singapore can expect to live at about 84 years old, which means that more than 1/3 of her life she's going to be in the menopause transition. There's a lot of evidence to show that a well-managed menopause will have better outcomes later in life as well.
The guidelines will be shared with family doctors and generalist physicians across Singapore.
And for more on this, I'm joined by Professor Yong Eu Leong, who is Head and Emeritus Consultant at the Department of Obstetrics and Gynaecology at NUH. Prof. Yong, welcome to the show.
Good evening.
Well, let's start with how extensive this problem of menopause is for many women. We know that 7 in 10 of women in Singapore face these symptoms. Can you share more?
Yes, exactly right. You know, women are getting more healthy and they are very well educated, and every woman undergoes menopause because, you know, our women are long-lived. They live a long time. So when you undergo menopause, fortunately, the majority of them, in my experience, actually go through them quite smoothly, you know, and with no issues. But about 30%, a third of them have severe symptoms. And this is the group of people we as medical professionals, as the conference have and the guidelines are aimed for, is to tackle this group of 30% of women who have moderate to severe symptoms. And I think there are very good therapies now available that the public and also the medical profession should be aware of.
Yeah, can you share more about these more severe symptoms, the 30% you were mentioning? What are some of these symptoms and what kind of treatment is available for them?
Yes. We did a study among 1,000 over women. We asked them what are the common symptoms, exactly like you said. Number one was joint pains and muscle aches. You know, in Chinese they call it seng. And the other one is poor sleep. The third one is vaginal dryness, and all these lead to mental exhaustion. And hot flushes is actually number 5 on the list, whereas it is number 1 in Western or Caucasian countries.
Yeah.
So this is a marked difference, and I think one of the aims of the guidelines is to let the Singapore public, the women, know about this, that these are the common symptoms: joint pains, poor sleep, mental exhaustion, and there are good therapies available.
It's very interesting that also in the report earlier, and as you mentioned, there is quite a difference between Asian women undergoing menopause and women in more Western cultures. Can you highlight what some of these differences might be? And are these studies also universally supported?
Yes. Hot flushes, of course, is the primal symptom for menopause. You suddenly have hot and then your hair is wet, and some people have their bedclothes drenched, and that is very disturbing. Because it disturbs your sleep. It happens 3 or 4 times a night. If you don't sleep, you get the brain fog, and you can't think straight. And our women nowadays are professionals, they are our colleagues, doctors, nurses, auditors. So they need a good night's sleep. Therefore, hot flushes can easily be treated by modern medical treatments. A lot of women and fellow professionals are influenced by old studies. 2002, the WHI Women's Health Initiative study, which put the emphasis a little bit slightly over on the risk adverse event side. But now there has been re-evaluation in Singapore as well as globally that the risk for hormone therapy, especially with the new topical preparations and oral progesterone preparations that we have, they are actually quite safe. Very, very safe. And suitable for a majority of menopausal women.
Yeah, interesting. Can we also discuss a little bit more about the healthcare professionals that might be exposed to many women who are suffering from menopause? Do you think they are well equipped to do so? Are there any gaps that can be plugged, perhaps with training, with greater awareness?
Yes. As I said, this WHI study was a very influential study. It was publicized in Time magazine and all the major newspapers, 2002. Before that, it was Feminine Forever. After 2002, it was plummeted to almost zero, because the risks that were highlighted were breast cancer, strokes, heart attacks, and this put a lot of women off menopause. So a lot of the doctors and health professionals around that period have this idea that it's unsafe. But recently, the pendulum has swung back towards more normal, and there has been a re-evaluation of the same data. It shows that actually it's safe, especially with modern preparations that we have that is topical and using natural ingredients, natural hormones produced by the ovaries.
Yeah.
So this message has not reached our women yet. Increasingly in the West, they are aware of it, but our women are not aware. And also our health professionals need to be updated as well. So that's the purpose of actually the guidelines, of which I'm a member also. We spent a few months formulating it so that it's very clear, so that everybody caring for menopausal women are on the same page.
Yeah, well, healthcare workers aside, on a day-to-day basis, many of us come into contact with loved ones, friends, colleagues who might be suffering from these symptoms. Do you have any tips for us in terms of how to be more mindful and aware of what these women are going through, and then how we can support or perhaps direct to some kind of help if needed?
Yes. Repeated surveys, not only in Singapore and also surprisingly overseas, have shown that joint pains and muscle aches is the most common symptom experienced by women during this menopause transition. And surveys in Malaysia, Singapore, China, Japan, even United States show that this joint pain, but somehow it's a little bit ignored. And I have patients coming in, and they don't have hot flushes, but they suffer from these severe joint pains. But then they are sent to the wrong specialty and sometimes not given the appropriate treatment.
Yeah, it's not linked to menopause.
It's not linked to menopause, exactly right. So it's not considered part of the menopausal syndrome, you see. So we are trying to change that a little bit, yeah. So, it's part of the menopause. So do not get too worried, and there might be good treatments coming, you see. Yeah.
Very hopeful message. Thank you, Prof. Yong, for coming in and sharing more insight about this condition. I've been speaking with Professor Yong Eu Leong, who is Emeritus Consultant and Head of the Division of Benign Gynaecology at NUH.